We're talking 25, 30%. So that would suggest that even brief, non-exercise, vigorous, intermittent physical activity can move the needle in terms of health outcomes. And of course, we would suspect that maybe it has to do with some of these cardiovascular or metabolic changes that we know are associated with health. So that's not cause and effect evidence. It's observational evidence over time, but it was very robustly done the way the work was conducted. It's quite compelling, I think.
I agree, because after you shared those studies with me, I read them, and I think even on the higher end, so you mentioned kind of the conservative, 3 to 4 minutes a day, when they were getting up to more like 9. I mean, you're talking, it was like 50% reduction in cardiovascular related mortality, 40% reduction in cancer related mortality. I mean, that's really incredible that these people are just doing this, choosing to do these short bursts of, vigorous intensity exercise, and then having substantial benefits on, longevity and health span, basically.
If I can add, the other key thing from that study, I think, is that all of these people were self-identified non-exercisers. And so the point is, even people who self-identify as non-exercisers seemingly are still engaging in vigorous activity through the day. Now, part of that might be their physical capacity is quite low. And so what it takes to get them into a vigorous intensity range is not very much. And actually, as part of that study, it was repeated in individuals who also identified as exercisers, and the same phenomenon were apparent. So even in exercisers, engaging in VILPA-like activity was still protective.